7 foods to avoid if you have an enlarged prostate over 50. An enlarged prostate, also known as BPH, is a usual issue in men over 50. It can make peeing hard, cause the need to pee a lot, and lead to pain in the lower belly and between the legs. Here's what's going on. The prostate gland is right below the bladder. Pee flows from the bladder through a tube called the urethra. If the prostate gets bigger, it presses on the urethra. This pressure causes pee problems. Pee can't flow out easily, which might make you need to go a lot, especially at night. Sometimes you feel like you have to go urgently, but only a bit comes out. Your pee stream might be weak or stop and start, and you might have to push to get going. Enlarged prostates are often due to hormone imbalances, with too much estrogen, insulin, or DHT. Some foods can make these hormones increase, leading to more swelling of the prostate. This raises the risk of infections and even prostate cancer. I'm going to tell you about 7 foods to stay away from if your prostate is enlarged. I'll also talk about some easy lifestyle changes and home treatments to help reduce your prostate and make peeing easier. Remember, this video is just to teach you more. Talk to your doctor if you're worried about your health. 1. Dairy. Dairy products contain hormones like estrogen that are naturally found in milk-producing animals. High levels of estrogen in men can alter the balance between testosterone and estrogen and potentially stimulate prostate growth. Some studies have suggested that diet high in animal fats, including fat from dairy products, can lead to increased inflammation in the body, which might contribute to prostate growth. High calcium intake has been linked to an increased risk of prostate cancer in some epidemiological studies, and dairy is a major source of calcium. It is not clear whether calcium itself contributes to prostate issues or if another component of dairy is responsible. More research is necessary to clarify this relationship. Dairy consumption can raise levels of insulin-like growth factor 1, IGF-1, in the blood, which has been associated with increased prostate size and possibly prostate cancer in some studies. Some individuals have a sensitivity to dairy or are lactose intolerant, which can cause additional issues such as digestive discomfort and inflammation. Eliminating dairy as a trial could be one strategy to see if symptoms improve, but this needs to be balanced with ensuring adequate intake of other nutrients dairy provides, such as calcium and vitamin D. These nutrients are essential for bone health, and finding alternative sources is important if one cuts out or reduces dairy intake. Non-dairy sources of calcium include fortified plant milks like almond milk, leafy green vegetables, and fortified cereals. 2. Vegetable oil. Vegetable oils, commonly referred to as seed oils, are extracted from the seeds of plants and include oils such as soybean, corn, canola, sunflower, and cottonseed oil. These oils are high in polyunsaturated fatty acids, PUFAs, particularly omega-6 fatty acids, which are pro-inflammatory if consumed in large amounts relative to omega-3 fatty acids. Chronic inflammation is believed to play a role in the development and progression of BPA. Omega-6 fatty acids, which are abundant in many vegetable oils, can be converted into inflammatory compounds in the body. A diet high in omega-6 fatty acids may therefore contribute to increased inflammation, potentially exacerbating symptoms of BP. Vegetable oils can influence the hormonal balance within the body. They have been shown to affect the metabolism of different hormones, which may have implications for the prostate. For instance, some evidence suggests that high-fat diets, especially those high in certain fats like omega-6 fatty acids, might be associated with changes in testosterone levels, which could potentially have an impact on prostate enlargement. Here are some general diet tips that have been suggested for those with BPA. Avoid saturated and trans fats. While the focus here is on vegetable oils, it's also advisable to limit the intake of saturated fats and trans fats found in processed and fatty meats, along with trans fats in partially hydrogenated oils. Increase omega-3s. Consuming more omega-3 fatty acids from sources like fish oil, flax seeds, and walnuts can help balance the ratio of omega-3 to omega-6 fatty acids and reduce inflammation. Eat more fruits and vegetables. These food items are rich in vitamins, minerals, and antioxidants, which can help combat oxidative stress and reduce inflammation. Stay hydrated. Proper hydration is important for urinary health. Drinking plenty of water can help reduce bladder irritation and urinary tract infections, which can be more common in men with BP. Before we continue, if you have been enjoying the video so far, hit the like button, and don't forget to subscribe and hit the bell icon, so you don't miss more videos like this. 3. Sugar and starch. High intake of sugar and starch can contribute to the development of metabolic syndrome, a cluster of conditions that includes increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. Metabolic syndrome increases the risk of cardiovascular disease, type 2 diabetes, and has been linked with the progression of BPA. A diet high in refined sugars and starches can lead to insulin resistance. Insulin resistance may not only increase the risk of developing type 2 diabetes, but also can influence the levels of certain hormones, like insulin-like growth factor, IGF, which has been suggested to play a role in the development of BPA. Sugars and high glycemic carbohydrates can prompt an inflammatory response in the body. If the diet contributes to chronic inflammation, it could potentially worsen BP symptoms or contribute to the disease's progression. By avoiding these foods, inflammation could potentially be reduced. High sugar and starch diets often lead to weight gain and increased body fat, which is associated with the development and progression of BPA. Obesity can also contribute to increased estrogen levels, which have been studied for their relationship to prostate volume. Controlling sugar and starch intake is an integral part of maintaining a healthy weight and potentially managing BP symptoms. How to avoid sugar and starch? Read labels. Be vigilant about reading nutrition labels to keep track of sugar content in packaged foods and beverages. Choose whole grains. Replace refined grains with whole grains, which are digested more slowly and have less of an effect on blood sugar. Limit sweets. Reduce consumption of sweets like cookies, cakes, candy, and sugary drinks. Whole foods. Focus on whole, unprocessed foods, which tend to be naturally lower in sugar and higher in dietary fiber. Complex carbohydrates. When you do eat carbs, choose complex ones like vegetables, legumes, and whole grains that have minimal impact on blood sugar. Cook at home. Preparing meals at home can help control the amounts and types of sugar and starches you consume. 4. Unfermented soy. I've already said that soy oil can cause problems, like swelling in your prostate and liver damage. But you should also know that a lot of our foods have cheap soy proteins added to them. These soy proteins, like soy powder, are put into many foods like diet shakes, microwavable meals, vegetarian burgers, snack bars, infant formula, and some meat products. This soy powder can make your body produce a lot of insulin, which is a hormone that can worsen prostate swelling and urinary troubles. Soy powder can also increase your estrogen levels, and too much estrogen can make your prostate bigger. Moreover, most soy is GMO and is grown with chemicals like pesticides and insecticides, which mess with your hormones. Also, soy has a lot of phytic acid in it, which stops your body from taking in important minerals like zinc that your prostate needs to work well. So, if you're having any prostate issues, you should stop eating any soy products that haven't been fermented. It's okay to eat fermented soy products like miso, soy sauce, tempeh, tofu, and natto. The fermentation process uses microbes that get rid of soy's bad effects, which makes it better for your health. 5. Alcohol. Alcohol can harm your liver cells and lead to increased levels of certain hormones like estrogen and insulin. This can cause problems like a bigger prostate and high blood pressure, which can weaken the walls of your arteries and veins. It's a good idea to drink less alcohol, particularly beer, since it boosts estrogen a lot. Instead, you could have 1 to 2 cups of kombucha tea in the evening. This can help you relax without drinking too much alcohol. Kombucha tea is good because it helps the good bacteria in your stomach, which can get rid of toxins and make more bile to help keep your liver and hormones in check. 6. Processed meats. Foods such as salami, hot dogs, canned meats, pepperoni, and ham are types of processed meats. These meats have chemicals, nitrates, sugar, and oils added to them. Eating processed meats can increase your chance of getting cancer. They can harm your cells and lead to problems with your arteries and blood clots. They can also harm the liver and make prostate issues worse, including raising the risk of prostate cancer. To be healthier, avoid these processed meats and choose better quality meats from local farms. Look for meat that is organic and comes from animals that ate only grass. This kind of meat doesn't have the bad chemicals that processed meats do and it's more nutritious. Grass-fed beef and organ meats like liver are rich in zinc, iron, and protein, which are good for the prostate and important for making reproductive fluids. Remember that each person's body and chemistry are different, so you should try cutting out different foods from what you eat to see if it helps with any bladder or prostate issues. In the video later, I'll show you 6 ways you can change your lifestyle and use natural treatments to make your prostate smaller. 7. Sodium. A diet high in sodium can contribute to fluid retention, high blood pressure, and strain on the cardiovascular system. Since men with BPH often have coexisting conditions like hypertension, reducing sodium intake can help manage blood pressure, which is beneficial for general health. Some medications often prescribed for BPH may have interactions with sodium levels. For example, certain diuretics used to manage symptoms associated with BPH may be less effective if a person consumes a high-sodium diet. Excessive sodium can lead to weight gain due to fluid retention. Obesity is a risk factor for developing more severe BPH symptoms. A low-sodium diet can help maintain a healthy weight, which is important for managing BPH symptoms. Let's explore 6 common reasons why prostates get bigger. First, let's understand some reasons why the prostate might enlarge. 1. Eating too much junk food, like sugar, white bread, and pasta, can use up your body's zinc, which leads to higher levels of certain hormones that make the prostate grow. 2. If you're carrying extra weight, your body might have more of those same hormones, which can cause the prostate to get bigger. 3. As you age, your stomach doesn't use nutrients as well, making it harder to get the zinc your prostate needs. 4. If your liver isn't working right, it can't get rid of extra hormones, which might lead to prostate growth. 5. Foods that aren't organic may have small amounts of harmful chemicals that can damage the liver and mess with hormone levels, causing the prostate to grow. 6. If your prostate is already bigger, dairy and processed meats might be making it worse because they have hormones in them that can affect your body. How to shrink your prostate. 1. Eat a few pumpkin seeds every day. They're good for your prostate because they have zinc, plant-based compounds, and vitamin E, which help balance your hormones. 2. Try taking 120 milligrams of stinging nettle root 3 times daily if you have trouble peeing. It can reduce swelling in your prostate to help you pee better by blocking certain hormones. 3. Cut down on dairy, sugar, vegetable oils, and processed meats. These can cause hormone imbalances and swelling in your prostate. And if you smoke, try to quit because it can make your prostate bigger. 4. Eat a salad with veggies like radishes, broccoli, arugula, kale, and cabbage every day. These veggies help your body get rid of extra hormones that can make your prostate grow. 5. Do high-intensity exercises for 10 minutes twice a week. This can boost your testosterone and help lower other hormones linked to prostate growth. Exercise also uses up extra sugar that could cause swelling in your prostate. 6. If you're overweight or drink alcohol often, try intermittent fasting. Eat all your food within a 4-hour period and don't eat for the other 20 hours. It's good for reducing prostate size and cleaning out your liver. In conclusion, an enlarged prostate can be a significant source of discomfort and inconvenience, but modifying your diet can help manage the symptoms. We've highlighted 7 foods that may exacerbate the condition, including dairy, vegetable oil, sugar, unfermented soy, alcohol, processed meats, and sodium. Remember, it's not about eliminating these items entirely, but rather understanding your body's responses and making conscious choices about consumption. Always consult your healthcare provider before making any significant changes to your diet, as they can provide guidance tailored to your specific health needs. By taking proactive steps toward a balanced and prostate-friendly diet, you can contribute positively to your overall well-being and comfort. Thank you for watching, and don't forget to subscribe for more health tips and insights. Stay informed, eat wisely, and let's support a healthier, happier you.